Good morning. Today we're going to talk about the importance of dental health. I also want to give you a bit of a warning. If you hear steps behind me or in the background, these are actually my dogs walking around the house. So just wanted to give you a heads up. I learned about the importance of dental care for people with dementia at a dementia conference about a year ago. So I want to share some of the information that I learned with you. We're going to talk about a lot of information today. And so what I'm going to do is give you the information today that I have for you. And then we're going to take a break for tomorrow. And then I'll come back the next day and give you the rest of the steps involved with dental care. So here we go. Poor hygiene, of course, can lead to bad breath, but I didn't know that it could also lead to complications like heart disease, stroke, gingivitis, and even osteoporosis. Poor dental health can also affect your ability to eat, to chew, and to talk. Many dementia patients are on a lot of medications, and oftentimes those medications cause dry mouth, and dry mouth can lead to tooth decay and gum disease. Dry mouth can also make it harder for people with dementia to eat, swallow, produce saliva, and it can cause tongue irritation. Another thing to consider is that brushing takes a lot of steps. We take it for granted because we've been brushing since we were probably, at the oldest 2, maybe 3 years old. But it involves quite a few steps. You have to pick the toothbrush up. You have to take the top off of the toothpaste. You have to squeeze the toothpaste onto the brush. Then you have to begin the brushing process. So there are a lot of steps involved that your loved one may have forgotten. So here are a few basic tips. First of all, do not try to force them to open their mouths. You could get bitten, okay? And this could be a recipe for disaster. If they have forgotten the steps, you might have to do those steps for them. You might have to take the top off of the toothpaste and put the toothpaste onto the brush. In my situation, that's what I had to do. I had to squeeze the paste onto the brush. And quite honestly, it got to be very difficult for my loved one to do those rotating motions and look in the mirror at the same time. You got to remember that they may have lost some of their strength and therefore they may not be able to squeeze the toothpaste onto the brush. They may have impaired coordination, and you may have to do what's called hand over hand. And that's where, if they're holding the toothbrush and they're trying to, and they can't brush, then you can take your hand and rotate your hand in the brushing motion in their mouths for them while they're holding the toothbrush. You can model the steps if they're still able to brush, but they may have forgotten. You can model the steps by having both of you stand in front of a mirror, and you can do it, and then they can follow along with you. And you can also stand behind them and brush their teeth if hand over hand is difficult for them. But if you do that, make sure you're standing in front of a mirror because it'll be harder for you to manage that. But standing behind the person has been very helpful for other people who are having to help their loved ones brush. Be sure to floss regularly. Flossing, once again, is a difficult process. So just using the string floss might not work. It might work for a short period of time, but it's probably not going to work for a long time. So what you can do, what I did was I got some of those Plackers, Plackers, toothpicks. They have the string on them on a handle, and the handle also has a pick built into it. you can gently use those plackers, and then Dentex, the company Dentex, Dentex, makes little toothpicks that have bristles at the end, and you can use those to go between the teeth for them. And my loved one preferred those. They really liked using the Dentex and the plackers, and they used them themselves until they couldn't any longer. So I hope these tips and this information helped. As I said, this is a lot to process. And I hope you can use this information to make brushing easier if your loved one has gotten to the point to where they can't manage it for themselves. So remember, I'm taking a day off tomorrow, and then we're going to come back with the rest of the steps and information about the importance of dental care. So thank you. You have a good day, and I'll see you on Thursday.